friends, and I'm going to present our project, which was just published in JMRI, which is called Improved and Automated Detection of Papillary Muscle Infarction using joint bright and black blood lead gadolinium enhancement MRI. So a little bit of introduction with anatomy here. Papillary muscle are small structures that are located inside both ventricles, and basically they contract during systole in order to prevent the blood from going back into the arrhythmias, which is called regurgitation. Papillary muscle infarction concerns up to 1 out of 2 patients with myocardial infarction and involves an impaired prognosis, as it's linked with higher mortality, increased major adverse cardiac event rate at 1-year follow-up. It's also linked with mitral regurgitation and ventricular arrhythmias, or even rupture of the papillary muscle. So indeed, there is a real need for a fast and efficient and precise detection of papillary muscle infarction. So the gold standard for myocardial tissue characterization, especially in the ischemic setting, is MRI, and particularly the PSIR sequence, which is a bright blood lead gadolinium enhancement sequence, so it requires the intravenous injection of a contrast agent. So PSIR is our gold standard, and it provides a great contrast between the infarcted and the healthy tissue. But the contrast at the blood scar interface is actually pretty poor, as we can see here, for example, on this 70-year-old patient male. We barely can say if the papillary muscle are damaged or not because of this poor contrast at the blood scar interface. So this represents a real challenge for us because especially for papillary muscle that are located inside the blood pool, so papillary muscle scar may be difficult to visualize using this gold standard. So the main innovation here is the SPOT sequence. So SPOT acquires co-registered bright and black blood images. So the anatomical information comes from the bright blood image, while the scar information comes from the black blood. And when we merge these two images, we obtain this kind of fusion slices because both images are co-registered, and this fusion slices allows us a precise localization and visualization of the infarcted areas, and especially for PMI. So SPOT is a 2D BSSFP sequence that acquires bright and black blood images in an interleaved fashion, where each images are acquired on 1 heartbeat. That's why images are co-registered. So the objectives of this study are twofold. First, to evaluate SPOT for visual PMI detection compared to the gold standard PSIR. Secondly, to develop an automated PMI detection, which has never been done before. So the automated detection starts with the acquisition of the SPOT images. So as I said, black blood and bright blood images are acquired on each heartbeat. And when this is done, slices go through a slice selection module where basal and apical slices are excluded in order to focus where the papillary muscle are located anatomically, so in the mid-ventricular ones. So when this is done, a deep learning model that we trained will segment the left ventricular endocardium on the bright blood image, and these contours are propagated onto the co-registered corresponding black blood image. We can after that apply several mathematical operations to focus only inside the blood pool where there is a potential enhancement of the papillary muscle. After that, we apply a simple criterion to decide whether the enhancement corresponds to potential PMI or not. So for the experiments, we use a 198 dataset that was divided onto 2 datasets, one optimization for the automated detection and one testing dataset to evaluate the performances of both visual and automated detection. Furthermore, we performed the ablation of the papillary muscle on one chip to mimic PMI for validation. And for the analysis, we applied a binary scoring on PSIR and SPOT images in order to get a consensus reading regarding both sequences, where 0 meant no PM enhancement and 1 or both PM enhancement. Then we were able to perform different metrics to evaluate the visual and the automated PMI detection. So for the results concerning the animal experiment, we could easily observe a high spatial concordance between spot and ex vivo images. So as we can see here, the ablated areas are really enhanced and corresponded to the anatomical findings. And furthermore, the contrast was better with spot compared to PSIR. For the visual detection, spot allowed to detect significantly more PMI compared to PSIR. Spot provided a higher sensitivity and accuracy, as well as an improved inter and intra-observer reproducibility compared to PSIR. So if we focus again on the 70-year-old male, when it's really hard to decide whether there is PMI or not on PSIR, spot clearly enhances the damaged areas of the papillary muscle. For the automated detection, the algorithm provided a higher sensitivity and accuracy compared to PSIR, as well as the visual detection, and a processing time of less than 2 seconds per patient. And here we have the different steps that lead to the diagnosis, or at least the decision that is made by the algorithm. So to conclude, spot may improve visual PMI detection for radiologists. And co-registered bright and black blood images facilitated the development of an automated PMI detection that leads to a better decision for the patient and for the risk stratification. Thank you for your listening. I thank all my team, and you can contact me if you want on this different link.